I hope this video series on building and maintaining long-term brain health has been beneficial for you. I thought it'd be good just to summarize the key points of the 8 previous videos, not counting the introduction. So, we've done 8 videos here for you on how to build and maintain your long-term brain health. So some of the key points that come to my mind. Number 1, long-term brain health is really more of a lifestyle issue than it is a genetic one. Yes, there is a DNA component to it. However, you can greatly reduce your risk factors for dementia and Alzheimer's and even stroke through some simple lifestyle changes, eating changes, adding some exercise, using some mindfulness practices, and as I've said before, leveraging the beauty of Mother Nature. The other key way, and particularly those of you who are millennials or younger, Generation X, Generation Z, whatever the new nomenclature happens to be, please, please, please note that multitasking is as toxic to your brain as smoking is to your lungs. So I know you grew up multitasking, you think you're really good at multitasking, you think you're more productive at multitasking. But all the research shows that, quite frankly, you're not more productive when you're multitasking. And when we talk about multitasking, we're really talking about cognitive multitasking. I mean, all of us can eat and watch a movie on TV at the same time. All of us can have a conversation while we're washing the dishes or while we're walking. That's not multitasking. What we're really talking about here is cognitive multitasking, particularly when you need to concentrate on a major project, something that's going to require a lot of brain power for you to focus on. That kind of multitasking is not good for you. So, and that means that all this switching back and forth between phone calls and emails and text messages and WhatsApp messages and whatever it happens to be, all that back and forth as you're working through the day, this is what tires your brain out. This is what adds to your brain fatigue. This is what adds to your brain fog. It's that kind of cognitive multitasking that is dangerous and toxic to your brain, just like smoking is dangerous and toxic to your lungs and to your overall health. Now, the other point, and we talked about in one of the videos, is how stress impacts your long-term brain health and how it also impacts the way you make decisions. So stress, particularly prolonged stress, constant stress, work-related stress, all that impacts the way you make decisions, your ability to make good decisions, and it impacts your long-term brain health. So the first decision you need to make, and that's why I titled my book, Better Decisions, Better Thinking, Better Outcomes, is that the first decision you need to make is, I said earlier, become a first responder. Learn to respond to events, situation, and people. Don't react to them. So that's your first decision. And by making that decision, it will lead you to better thinking, use of better questioning, taking time for reflection. And when you have the time, the ability to do better thinking and get away from the binary decision-making that the brain likes to force us into when it's under stress, when it's tired, get away from binary decision-making. This is how you create better outcomes. Okay, so remember, stress is going to impact your brain. It's going to impact the way you make decisions. Now, stress can't be prevented. We're all going to have stress, particularly in today's world. But you can learn how to control it, and you can learn how to minimize its impact on both your long-term brain health and on your decision-making. Other steps you can take to build and maintain your long-term brain health, well, manage your blood pressure. And part of that is the way you manage stress, but it's also your dietary habits, the kind of foods that you eat, the lack of exercise. All these things can increase your blood pressure. Manage your blood pressure. Obviously, first talk to your doctor about it. Get his or her advice on how you can manage your blood pressure. This is a medical situation. You want good doctor advice on it. And talk to your doctor also about how do you control the cholesterol levels in your blood? And how can you keep the blood sugar levels in your blood, at the normal ratings for your age? So, and part of this means really you should have that annual physical with your doctor. And these are the 3 key things you should be talking to your doctor about because they also impact your heart. Blood pressure, cholesterol levels, blood sugar levels, they have a correlation to heart disease and they have a correlation to brain disease. So these 3 topics you should be talking to your doctor at least once a year about and getting their advice, their recommendation on what you should do to keep your blood pressure under control, keep your cholesterol levels in your blood under control, and keep the blood sugar levels in your blood under control. And it is highly recommended, and neuroscientists are now showing us that exercise is important for the long-term health of your brain. Again, as we said earlier, we're not talking about running half marathons or spending 60 hours in a gym 4 times a week. No, 20 to 30 minutes of some aerobic activity, as simple as walking, combined with, if you can, a little bit of strength exercise, whether that's isometric exercises like push-up at home, or if that means going to a gym and lifting a few weights. But get physically active, particularly get walking. And of course, eat a healthy diet. Get away from the fast foods, from the sodas, even the sugarless sodas or the diet sodas, whatever they're called. All those have other chemicals in them that are not good for the long-term health of your brain. So lose any excess weight you may have accumulated. Look, we live in a society where we love to eat and we don't have time to exercise, and we sit around in meetings too often. And for many people, particularly once we hit our 40s, we start packing on those extra pounds. And it's, again, as I've said before, particularly men who put on the most abdominal fat in their 40s have the highest risk for dementia in their lifetimes, usually in their 60s or 70s. So if you're past 40, get rid of that extra weight. If you're under 40, do everything you can to maintain your weight. Don't pack on that extra abdominal fat. And of course, quit or never start smoking. I mean, everyone knows that smoking is bad for your health. It's bad for your lungs. It's bad for your heart. And remember, your brain is the biggest user of oxygen and blood in your body. So what's not good for your lungs and what's not good for your heart is obviously not going to be good for your brain. So look, it's been my pleasure to bring this video series to you, to share with you some of the research findings I used in 2 of my recent books, along with some tips and best practices for building your long-term brain health. And as we finish, let me again share with you 2 of my favorite quotes. The first is that Irish proverb I shared with you, that no time for your health today means no health for your time tomorrow. And again, I've revised that. So please remember that no time for your brain health today will result in no brain health for your time tomorrow. And of course, the old Chinese proverb that says the best time to plant a tree was 20 years ago. The second best time is now. Again, when it comes to your brain health, the best time to start planning your long-term brain health is in your 30s and 40s. The second best time is now. Brain health is a lifetime pursuit, and it is never too late to start on a path to healthy brain health. Let me share some other resources for you that are free, and they're on my website, calianteleadership.com. You see here the homepage of the website. You'll see in the upper right-hand corner a little pull-down menu called Resources. You click on that or scroll over it, mouse over it. You'll see you come down, you have brain health and brain power articles. Every month I update anywhere from 15 to 25 articles on brain health and brain power. Below that, you'll see I also have leadership well-being, mindful leadership, mindful decision-making articles. So every month, again, another 10 or 15, maybe 20 articles on these topics get uploaded free. And here, I'll just click on this to show you. And under the brain health, you'll see I actually put the name of the article, what publication it comes from, and it's a hyperlink to the article. Try to make it just as easy as possible for you to access these articles. Also under resources, if you're interested, I have a section of mindfulness and brain power books that I highly recommend. Again, the title of the book, the author, and if you click on either the picture of the book or on the blue description of the book, that will take you directly to Amazon, and you can get a description of the book, or if you want to purchase the book, again, you can buy it right off of Amazon as well. And I update this probably once a quarter or so. I add more books to it. So here, things about brain health, the whole brain business book, mindfulness, getting into flow, various topics all related to brain health and just helping you, again, build and maintain your long-term brain health. So that's it. I hope you've enjoyed this series. Again, if you're interested, my 2 books, Better Decisions, Better Thinking, Better Outcomes, and the second book, How Stress and Anxiety Impacts Your Decision Making. They're both available on Amazon in both paperback version as well as Kindle version. So hope you take a look at them. It's been my pleasure. This is Stephen Howard saying again, take care of your brain health, spread the message. It is a lifestyle disease. Alzheimer's disease and dementia are both lifestyle related. So change your lifestyle, protect your brain health, be better for yourself, better for your family, better for the society. Thank you very much. And as always, best wishes for continued success. Thank you.